Welcome to this webinar entitled Preparing for a Rewarding Career in Healthcare Design, presented by the Future Healthcare Designers Mentoring Network. I'm Tammy, and I will be your moderator today as we jump into this exciting topic. A little bit about myself. I am a licensed architect. I've been practicing architecture for around 20 years and always focused on healthcare design. I've had some interesting experiences from a background on a construction site in construction management of a healthcare project and other projects like education. I've also had an opportunity to practice in a firm in the traditional sense as a healthcare architect. Specifically, I served as a medical planner and would meet with the clients up front and help them to understand what they were getting, to get their feedback and incorporate that into the design. And I've also had the wonderful opportunity to work for a health system. I'm on my second health system now, but I had the great chance to work for a health system where I served as the facility operational planning manager. This allowed me to help healthcare teams to prepare to move into their new building. So I had a chance to shadow every team in a hospital and then to learn more about their operations, their workflow, as well as taking them out to the construction site and familiarizing them with their new space so that they could see the difference between their older space, their newer space, and start to make some planning decisions on how they would use that newer space. So, my role in that sense was to connect the architecture that was designed by someone else to the actual purpose of the building, helping the users to prepare to move into the space. It was a wonderful opportunity. I now serve as a design director, and this allows me to incorporate new and innovative designs, working specifically with user groups and hospital departments to understand their needs and to help them to envision something that would be spectacular for them to move into. And then I would work with the design teams to help translate that vision to the design teams who would ultimately develop the set of drawings.
Hi, everyone. I'm SB Harper, and I am a practicing architect. I've been doing healthcare design for almost 25 years and absolutely have loved it. I am in the Southeast area working for a large firm here in the Southeast. And my current role is actually as an innovation leader, but also bringing innovation and innovative ideas to the healthcare space as well. I really got into healthcare design after really wanting to pursue a career as a physician and ended up navigating to architecture school from a thinking about pre-med and then moved into becoming an art history major with an architectural engineering minor and then went on to graduate school for architecture, but really was enthralled with the idea that I could still have that interest in medicine and the idea of healing and having places to heal in my profession as an architect. And so I've been loving it ever since. Thank you.
Awesome. Tim, would you like to introduce yourself?
Thank you, Tammy. My name is Tim Fishgang. I'm a partner with Moody Nolan and our healthcare practice leader. I joined Moody Nolan about 6 years ago, and I was brought into the firm to build a national platform for healthcare across our 12 offices and have enjoyed every minute of the past 6 years. But I started my career in architecture 41 years ago, believe it or not. And I was brought into or got a job right out of school with NBBJ. I was at NBBJ for about 31, 32 years, but was hired to work on a high-rise office building in downtown Columbus. But like a lot of big projects, it was slow in getting started. So I had an opportunity to work on some law firm, TI work, multifamily housing, higher ed, and some healthcare projects. So as I went through my career, I began to get involved in more healthcare and really was drawn to the complexity. And in many cases, these were large greenfield hospitals that I was a PA on, and then a PM, and then leading as a PIC. And while I was drawn to it because of the complexity, I really then began to fall in love with that aspect of our profession because of the greater good it's serving to our communities. So that's my brief story, Tammy.
Thank you. I want to also ask because we do have some students on the line who don't have any background or history so far in architecture and in the office. So if we could define the acronyms that we use, like PIC and PA,
So
or
yeah, sorry about that. So a PA is a project architect leading the technical development of a project and coordinating all the consultants that are involved. The project manager is managing the project. And the PIC is either partner in charge or principal in charge, and they're really a client executive relationship manager. And it varies from firm to firm, but I will be cautious of that.
okay, thank you. Mike.
Thank you, Tammy, and welcome everyone. It's glad that you could be here today and join us for this webinar. I'm Mike McKay. I'm a practicing architect as well, registered and licensed in multiple states across the country. I am leading the healthcare practice for Erdman, and we are located, our corporate headquarters are located here in Madison, Wisconsin. We do have some other offices scattered around the country as we are a national practice in architecture, engineering, interior design. We also offer consulting and management services for healthcare entities, and we also do our own development work. Erdman, if some of you want to go back into history, Marshall Erdman was the founder of the company, and Marshall was Frank Lloyd Wright's builder. Marshall built several of the original Usonian homes for Frank here in Madison. And as it so happened, several of those clients were physicians. That got Marshall interested in doing healthcare work and specifically medical office building work, and that formed the genesis of this company. We were a design build integrated project delivery company up until a couple of years ago and have now transitioned fully into just architecture, engineering, interior design, and consulting. Most healthcare clients around the country have preferred local contractors that they like to work with. So our model continues to change to respond to the industry as well. I got into healthcare kind of like Tammy. I actually found myself a patient in the hospital in my thesis year at Ball State University, where I graduated from, and got intrigued with my hospital surroundings. And immediately thereafter had a couple of firms talking to me about work, one of which was a healthcare-oriented firm at that time in Fort Wayne, Indiana, who actually served as the quote-unquote house architect for several local hospitals. And that's really where I like to say I grew up and cut my teeth, learning about healthcare, working directly with the physicians, the nurses and providers and staff in hospitals really piqued my interest, and I've stayed with healthcare my entire career. I look forward to sharing with you all today, and I will also try to watch the acronyms. Healthcare is chock full of lots of acronyms, so we'll try to be mindful of that moving forward.
Thank you, Mike. We'll pass the mic to Taft.
Good afternoon, everyone. It's a joy to be here and welcome. I am Taft Cleveland. I am a certified urban planner and an architectural designer at Smith Group in the Chicago office. My role is threefold in that I am part of the community engagement team, as well as working with the healthcare side of working on hospitals and wellness centers, and having my hand also in architecture and urban planning. One of the things that I enjoy about what I've been doing for almost 20 years is that I get to meet the people from the very beginning of working on a project and working on that project all the way through to capture their ideas and the things that they need And that gives me a joy working on the projects. One of the things that it was interesting just listening to my colleagues earlier, when I started healthcare, I was already 5 or 6 years out of my college years before I even started working on healthcare. I was primarily in urban planning and architecture and working on higher ed projects. So I kind of stumbled into healthcare because those projects were available at the time. And one of the things that I found a joy is working with different communities. My first project that I worked on was in West Bloomfield, where my family lives in Michigan. And so having a project in my in a city where my family lives gave me even more of empowerment to help not only the patients at that hospital, but also to reflect on my family's values and give them something that they needed as well. So thanks, Tammy.
Thanks, Taft. And last but not least, George Smith.
Well, Taft, you set me up really well because I am an urban planner by college degree because calculus threw me out of architecture at Georgia Tech back when it was a lot darker. Um, but I literally, you may have stumbled, Taft, but I fell into um, healthcare architecture when they weren't hiring urban planners, and my roommate connected me with the facilities team over at Emory University Hospital. I am the senior architectural project manager with the Grady Health System now. We're the large urban safety net hospital downtown with about 4 million square feet, which sounds big until I get into the room with some of the other uh, health systems in the country. But the hospital itself is about 2 million square feet with another 4 scattered around town in nursing home, outpatient health centers, and the HIV AIDS primary care and research center about a mile from the main campus. I've been with Grady since 2000, and I've been with Tammy since about 12, 15 years now as an advisory board member to the institute, and it's just been continuing to increase my education and engagement with what I'm doing. And in the 4.5 years that I've been in healthcare, I would say maybe 2 have been outside of it. And every time I've stepped away, I have been brought back into it because while I don't have the dollars of the big donors and I don't have the intestinal fortitude of the surgeons, I do have a heart for the people that we take care of and for the people that take care of those people. And so this has been an even more satisfying career than I could have thought of based on what I was doing as an undergraduate in the 2 different universities I attended trying to get out of school.
Thanks, team. Now let's jump right in and get started. Here's the agenda. We've introduced ourselves already. Now we'll go ahead and talk about how to get started on the path to architectural licensure. Then we will jump into seeking an internship or job, and then helpful links and next steps. If your goal is to become an architect, it's important to learn as much as you can about the path to architectural licensure as early as possible. Visit ncarb.org to learn more and establish a council record so that you might start tracking your progress. ncarb.org is the official website of the National Council of Architectural Registration Boards. NCARB is a nonprofit organization that works with architectural licensure boards across the United States to facilitate the architecture licensure process for new architects and to help existing architects attain licensure in multiple states. The National Architectural Accreditation Board, also known as NAAB, is the agency in the United States authorized to accredit professional degree programs in architecture. If you're not in a NAB accredited degree program, you may want to search for a NAB accredited program so that you can meet the education requirements for licensure. If you're not sure if you are in a NAB accredited program, you might use this website, naab.org, and click on the NAB program directory to search and look for your school. If your program isn't accredited, consider applying to a Master of Architecture program that you might enter after you graduate from your current program. Then we'd love to invite you to join the Future Healthcare Designers Mentoring Network on LinkedIn. This network is available to provide access to seasoned professionals for information and mentoring support that you might need during your time as a student and also as an early career professional. We'd like to invite you to join NCARB.org, or actually go to NCARB.org and establish a council record. So this will allow you to track your progress toward licensure. NCARB has lots of great resources for you to learn more about the path to architectural licensure. Once you've joined, go ahead and start seeking jobs in the field. NCARB's website will provide instructions for you to document your work experience when you find a job in the profession. Be sure to review the qualifying work experience categories so that you are sure that you have a job that will count toward architectural licensure. So this includes, we call them internships. NCARB calls it the Architectural Experience Program, or AXP for short. Essentially, you would seek an internship while you're in school and then seek a job after you graduate, a full-time job. And for both of these types of experience, the AXP will help you to track your hours so that you will have the hours and experience that you need in certain categories, areas of experience, in order to gain that experience for architectural licensure. Before the end of each internship, you should submit your documentation to NCARB. And then NCARB will keep a record of all your jobs so that you're not scrambling at the end to document your experience from years ago. This is really helpful. After you leave a company, it might be much harder to go back and get your records signed. So be sure that you do this before you leave each internship or job. If you find that your employment is long term, for example, after you graduate and you take a full time job versus a summer internship, go ahead and set a regular cadence, such as once a month or once a quarter or even twice a year, to document your experience so that you won't forget. Also, keep in mind that your supervisor may also decide to retire or take another job. So it's much more helpful to have that person to sign your record before they leave rather than waiting until later and asking someone else to sign and document that experience on their behalf. When you've met enough of the education and experience requirements to take your exam, check with NCARB to request eligibility. This will allow them to confirm that you're eligible and give you the necessary guidance to schedule your exams. Now, back when I took the exam, there were 9 exams to take, and my strategy was to take one exam per month. This gave me a month worth of studying for that particular exam before I would take it. I would take that exam and then I would go ahead and start studying for the next exam on my schedule. I actually thought about all the exams, looked at the titles, looked at the description for each exam, and I took them in the order that I thought was best in terms of hardest to easiest exam. And so that allowed me to start with my most difficult exam or the topic that I anticipated would be most difficult for me, take that first, and then I move through with the easiest exam. But everyone can have their own strategy to tackle this. I would just say study with intention. Some of the things that I did when I studied was I would read my study guide and materials and record that reading. And then on my way driving in my commute to work, I would play that back for myself so that I'm just sort of recalling that information and remembering that information. And this was for obviously the exams that required more of, my understanding of a certain concept. For exams that required calculations, I had to take a different approach. I still described in general concepts on recording, and that was helpful. But then I spent lots of time after work and on the weekends working on those calculations and practicing. At the time, we had certain software that we used for the drawing portions of the exam. And so I made sure to download that and practice as much as possible with similar software so that it was easy for me to understand once I got into the exam how to do it. So those might be some helpful tips for you as you think about studying. Join a study group. There are multiple sources for study information. Many times, if you are a part of an architecture firm, they will actually purchase the study guides and materials, and you can check them out from their library. There are many online resources and tools, practice tests, and so forth. Take advantage of all of that information that you have at your fingertips to study and prepare for the exam so that you'll be successful during the exam. Then I'd like to share with you that new grads are eligible to join AIA for free. So look into this. Just go to and visit AIA.org. If you're a brand new grad and you're looking to join AIA, go ahead and do that, because you can also find a wealth of resources here in terms of their job board, in terms of education and events that the AIA hosts. Now, you don't have to be a member of the AIA to look at the job board and many of the resources that are available on the website for free.